Now we're going to talk about donning and doffing sterile gloves. Donning basically to put on and doffing basically to take off. So what we need to do is we need to start off with clean hands. So if I'm in a hospital setting, I'm going to wash my hands with soap and warm water. If I'm out in the field, I might have to use some sort of alcohol-based hand sanitizer. So I'm going to clean my hands. First, I need to look at the packaging. I need to inspect it. I need to make sure that there are no rips, discolorations, or that it's not damp. I also need to check the expiration date. Most medical products, if not all of them, have an expiration date. If they're expired, I have to discard them. I'm technically not allowed to use that on a patient. So I'm going to open from top to bottom. So there is basically a top and a bottom here. I'm going to separate the two, and I'm going to put it down on my clean surface. And I'm going to slide out my inner wrapped package. Then basically what I'm going to do is I need to open them. It kind of opens like a book. It has a 1-inch border on the inside, and I can actually touch only that 1-inch border. So I'm going to open them, and you can see the border. And I'm going to continue to open, touching just the 1-inch border. Now, as you can see, I have 2 gloves. So what I'm going to do now is I'm going to take my non-dominant hand. As you can see, there is a fold in the glove. So I'm technically touching the inside of this glove. So this glove is still sterile. I'm going to slide my hand into one glove. Then I need to get my other glove. So I'm going to take my 2 fingers and I'm going to slide my 2 fingers underneath that cuff. Now, these 2 fingers are touching the sterile side of the glove. So I have sterile fingers touching the sterile part of the glove. And then I'm going to insert my hand into the glove like so. And sometimes this happens, so I need to adjust. But I've touched only the sterile part of my glove to the sterile part of this glove. I'm going to now do whatever sterile procedure that I need. And now I'm going to talk about removing that glove. So I'm going to basically take the glove, remove it, take my fingers under the other part of my sterile glove so I do not contaminate myself, and dispose of the gloves. I'm going to check for any rips at the end of the procedure, and that's donning and doffing sterile gloves.